is radiology? What is radiology? Let's break it down. Rad for radiation, ology for the study of. So it's the study of radiation. Okay? Your suffixes and your prefixes, remember. Okay, so in the study of radiology, just let me give you a little quick, just free and for nothing information about the history of radiology. In 1895, Wilhelm Röntgen, doctor, and was a physicist in Germany, in Bavaria, the Bavarian region of Germany, was playing around with, electricity was brand spanking new at this time, okay? So he was playing around with photographic plates. At the time they didn't have film, they had plates that they used, and a tube that he had rigged up. And when he turned off the lights and accidentally, he exposed that plate, and it began to glow. Okay, so that was the invention at that point of the X-ray. In mathematics, if we have an unknown integer, what do we call it? X. And that's where the name comes from. It's the X unknown ray. Okay, so that's who invented it, and it was an accident, and it's literally changed our lives. Also then, there were several other, and it's all in your book. You can read, if you're interested in reading all this, and if you take the Danby, you'll need to know it. But there were different doctors who did different things. Dr. Röntgen also is the first one to ever take a radiograph of someone's body. Okay? He had his wife sit with her hand on the plate while he exposed it for, I believe, 15 minutes, something like that, 15, 20 minutes. I need to look back to see the exact time, but it was a heck of a long time, okay? And there's a picture in your book of a hand on a radiograph, and that's Mrs. Röntgen's hand. And you can see the bulge from her wedding ring on that radiograph. So he's the first one to ever expose the human body. Then there's Dr. Kells was in the United States, and he started using dental radiographs from there. And it was, he would hold the film in the person's mouth and expose for like a minute, which is an eternally long period of time. But he used the radiographs in dentistry. He was the first one to do that. So it wouldn't be surprising to find out that he died of, he lost his fingers and his hand, he was losing both of his hands, and he was going to be a burden to his family, and he committed suicide but the reason that he lost his limbs, his fingers and his hands, was because of the radiation exposure. So we're going to talk, in this course, we're going to talk about the safety of radiation. Okay? So the first thing that we're going to do is to talk about anatomy. And I'm going to go through these books. This is your booklets that the state of Wyoming put out for us to teach radiology. So we're going to talk about and we're going to go real quick through this because you guys by this time you know all this pretty easily. Okay, we have in the dental arches and the teeth. Do you want this? Does this help? Or maybe I need it.
Yeah, you might need it.
How does it? Don't I need something to go in there?
Yeah, I already plugged it in.
Oh, you did?
See if it works. Well, I could turn it for you, cause then I'll have to zoom in,
Okay,
but you
Okay,
can use
you
the
can
laser
turn it.
pointer if you want.
you can turn it then, I'm gonna give up. Okay, we're gonna go to the section 1. Course introduction and all that. Okay, we're gonna talk about the dental arches and the teeth. The maxilla, I'm just gonna call it out and you guys respond to it, okay? The maxilla is called the upper jaw is called the maxilla. The lower jaw is called the mandible. The basic to oral anatomy is naming the upper and lower jaws and the dental arches, okay? So then, we also have 4 quadrants. We have the right maxillary, left mandibular, and right mandibular. And y'all have learned it, that the right is quadrant number 1, quadrant number 2 is the left, quadrant number 3 is the left mandible, and quadrant 4 is the right mandibular arch, or quadrant. So it goes around from right to left, or from right to right in a circle through the mouth, okay? So you know your quadrants, and the names of the teeth, the central incisors, lateral incisors they're relatively sharp and thin. The next page. I'm on the next page. Yeah, there you go. All right. Okay, there are 32 permanent teeth in the adult dentition. Each quadrant has 8. 8 times 4 is 32. You'll never forget it. Okay. The names of the 8 teeth are the same in each quadrant. We have central incisors. We have a cuspid or a canine. We have central incisors, lateral incisors, and then canines or cuspids. They're the same. It's also called canine. We have our first premolar and our second premolars. They're also called bicuspids. You have your molars. There's 3 in each quadrant and are less pointed than the premolars and are used for grinding more solid masses of food. The first and second molar are usually visible, while the third molar is oftentimes called a wisdom tooth and is oftentimes not developed or in a functional position. Okay? Primary teeth. Primary teeth, that's the next page. Primary teeth are usually found in children. They are the baby teeth or the deciduous teeth. And they fall out when the permanent teeth grow in to displace them. We have 10 teeth in each arch, 20 teeth total, 5 in each quadrant. The primary teeth, there's a central incisor and a lateral incisor. There's a canine or cuspid, and then there's first primary molar and the second primary molar. Now, when the first primary molar and the second primary molar are lost, that's where your premolars come in. Your premolars will come in here, where the first and second primary molars are. They are called succedaneous teeth because they succeed. The premolars are succedaneous teeth because they succeed the primary teeth. Okay, so all of these are succedaneous teeth, but the first molar would be succedaneous or no?
Yeah.
No, because it comes in behind the primary molars. Oftentimes before any teeth are lost, they'll get the first molar, and then they'll start to lose their incisors. And usually it's the lower ones first. Okay? And they are non-succedaneous because they don't succeed other teeth. Does that make sense? Okay? All right, that's not necessarily in radiology, but it's something you should know. And the universal numbering system is the numbering system that you've been taught, the 1 to 32. So I'm not gonna go over that because you've pretty much got that system down. Also, the primary teeth is A to T. Yeah, A through T is numbered the same way. The same way. You start in the same place and start counting with the primary teeth. Okay, we're going to talk about directions. The anterior means what?
Towards the front.
Towards the front, that's exactly right. So your canines and your incisors are gonna be anterior teeth. So from canine to canine, upper and lower, is anterior teeth. Posterior means
To the back.
towards the back. So the posterior teeth are the molars and premolars. Medial means what? Medial, not mesial. Medial,
Toward the middle.
toward the middle, that's correct. That is a test question, so be sure that you remember that, highlight it. You can see I have it highlighted in my little, I'll tell you things that I recognize that are gonna be on the test. Everything that I say right on the board or have you highlight is gonna be on the test, okay? Lateral means what?
Towards the side.
Towards the side, that's exactly right. Mesial means
Middle.
toward the midline, toward the midline. So let's clarify that. Let's make a note up here. For medial is towards the middle. And mesial means towards the midline. Okay? Okay, so because I don't want you to get mixed up. That's just one letter difference in that, in that spelling. And they mean sort of the same thing, not quite, but sort of. Okay, so the surfaces of the teeth, you've learned all of that too. You know that the mesial surface of the tooth is toward the midline. You know that the distal surface is away from the midline. You know that the palatal surface of the maxillary teeth, because they face the palate, you know, or the roof of the mouth. You know that the mandibular teeth, they're called the lingual surfaces because they face the tongue. Okay, facial surfaces of the teeth are those that touch the face and the lips and cheeks. For anterior teeth, the surfaces facing the lips are called labial surfaces because they're close to the lip. Posterior teeth, the surfaces facing the cheeks are called buccal surfaces because they're close to the buccal or the cheek. This is the buccinator muscle, so that's why it's called buccal, to play on that same word. The occlusal plane.
Is that the one we're on?
I think we're on another.
Oh.
Nope,
Next one.
forward.
I'm
Forward.
just behind.
You're forward, you're fine, you're forward.
This one?
No,
No, it's-
yes, 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 yes.
Girl, y'all
Yes, yes.
confusing me.
Okay, look up here at this diagram here, where it talks about the occlusal plane. Okay, yeah, okay, anterior surfaces because they're close to the lip. Buccal because they're close to the cheeks. The occlusal plane, you see this line that kind of curves upward from the posterior, it's lower in the posterior and it curves upward. This is the occlusal plane. That's, when you have your teeth together, that's the plane. Okay, we're gonna use this term quite a bit. I wanna make sure that you understand what the occlusal plane is. Because when you're taking bite wings, you need to have the occlusal plane parallel with the floor. Okay, it needs to be at the same, in other words, not like this, not like this, it's gonna be parallel to the floor. Okay, so that's the occlusal plane. It's an imaginary horizontal plane or surface between the upper and lower arch, as if the teeth are biting on an imaginary sheet of paper. Okay? The occlusal surfaces are the parts that you chew with. The incisal surfaces are the parts that you bite with. And the proximal surfaces are those in between the teeth, right there where the two teeth come together. Okay? We had covered that when we talked about anatomy before. So this is just a kind of a review of your already accomplished anatomy. Okay, the parts of the teeth, the tooth. Next page, please. Okay, the anatomic parts of the tooth. Can somebody tell me what the difference in an anatomical crown and a clinical crown?
Is the anatomical crown like the natural tooth and the clinical crown like a synthetic tooth or?
No.
This one's kind of hard.
Yeah, it
To
is.
remember.
It is hard to remember, that's why I wanted to.
still can't remember it.
Okay, the anatomical crown is the part of the crown where you see the tooth here. This is the CEJ, or the cemento enamel junction. That's your CEJ. This is all enamel, okay? The part that has the enamel on it, on the tooth, no matter if it's this much erupted, if that much of it is showing in the mouth or not, okay? That's the anatomical crown, okay? If this tooth is only partially erupted, then the part above my little stick here is the clinical crown. The clinical crown is the part of the crown that you see in the mouth, okay? If it's not erupted completely. What if the gum has receded and you have this much showing? Where's the clinical crown now? The anatomical crown doesn't change. The clinical crown can change. Okay? Does that help? Speak to me.
Yes.
Okay? All right. So the anatomical crown is the part of the crown that has enamel on it that's covered, the anatomy is, it's correct anatomy, okay? For the clinical crown, it's the amount of the crown that you can see. So you can see in a partially erupted tooth, only the cusps maybe. In a receded tooth gum area, you're gonna see about this much. So depending on how much is exposed is what your clinical crown is. Questions?
No.
Okay. Okay, the long axis of the tooth. The long axis of the tooth is an imaginary line that extends from the top, from the crown to the apex. So the very incisal edge, all the way through the middle, dividing the tooth in half, from top to bottom lengthwise. It's an imaginary line. It's the long axis of the tooth. And we will be using that term extensively. Okay? So make sure that you know what the long axis of the tooth is. Any questions about the long axis?
No.
Okay. Moving on. Each tooth is made up of several tissues. The enamel is the hard tissue that covers the crown. It's the hardest tissue in the human body. The cementum is the softer tissue that covers the root of the tooth. Okay, it covers the root of the tooth. From the CEJ, cemento enamel junction, all the way around the root of the tooth. It covers the root. It's the soft tissue that covers the root, okay? Under the enamel is the dentin, and that's under the whole tooth. So you do have dentin up in the crown, you do have dentin down in the roots, okay? It's the inner layer of the tooth, and it covers, it comprises most of the tooth, okay? Then in the extreme center of the tooth, this darker area, it's gonna show up darkest on a radiograph because it's soft tissue and it's less dense, okay? The more dense the tissue, the whiter it looks on the radiograph. And we're gonna talk about radiolucency and radiopacities, but this is gonna be radiolucent, okay? It's that dark part that covers from the apex, that's where the nerve exits, and this is the nerve and blood supply of the tooth, okay? Questions about the parts of the teeth? We know where the enamel is, just the outer edge of the tooth. We know that the cementum covers the root of the tooth. It's just the outer layer on the tooth, and then the dentin is the majority of the tooth. Okay? And then the pulp is the inner dark portion. Okay? Around the tooth, it's important to know that the tissues and structures that support and supply that tooth with what it needs to live. So each tooth is supported by its functional position in the jaw by the alveolar bone. What is the purpose of the alveolar bone? The purpose of the alveolar bone is to support teeth. It's the socket that the tooth fits in. Periodontal ligament is a soft tissue attachment, soft tissue, connective tissue that surrounds the root and connects it to the alveolar bone. Okay? It has little fibers that run through it. I like to think of them as like guy wires. If you've seen, I don't know, like the tower. Let's just use a cell tower for an example. You see these cell towers, and they're like straight up. It's just straight up. And then they have these wires that come to the sides that hold it in place, and it allows it to flex in the wind. The same thing happens with the periodontal ligament. It attaches to the alveolar bone, to the tooth, these fibers, and it allows the tooth to move up and down, back and forth, because your teeth are not like cemented into the bone, okay? They're suspended by fibers. Okay? All right. Questions about any of that? I know that's kind of out there. You probably hadn't heard that before. Okay. Laminadura, we didn't get to the laminadura.
Oh, my bad. That's my bad.
That's okay.
I
That's
was
all
ahead
right.
of myself.
That's all right. I love you for doing this. Okay, laminadura is the thin bone that lines the alveolar socket and allows the blood and lymph vessels and nerve fibers to pass from the periodontal ligament to the bone. Okay, so that's how it's all nourished. Okay?
We're good?
We're good.
Okay.
Okay. So the gingiva, the gingival tissue is commonly called what?
The gums.
Gum tissue. That's on the test, that's question number 100, and I promised a butt whooping to anybody that misses it, okay? Such an easy question. The gingival tissue is commonly called gum tissue. Yeah, I don't accept that as a wrong answer. That one just, yeah, we don't go there. Most of the gingiva is attached to the enamel surface of the teeth, and it is called the attached gingiva. We talked about that last week. We pointed it out, and everybody did real good on that. So you know where your free gingiva is. It's the space around the tooth. It's also called the gingival sulcus. Okay, so this is the sulcus. Free gingiva is also called the sulcus. The depth of the sulcus is usually 2.5 to 3 millimeters. We say if it's 3 millimeters or below, it's healthy and normal. Okay, so when we're doing our periodontal probing, which you're going to get into later with us, you don't do it. The hygienists and doctors do it, but you record it. So that's where your part will come in. But yeah, we it's like, okay, at LCCC with the students, if they've already probed one time, all they have to do is record the numbers that are greater than 3. And that's pretty common industry-wide, is that we don't necessarily record them all. Here we do, in this office we do record them all, but it's not uncommon for you just anything over 4 or over. But anyway, so that's where we measure the sulcus to see the depth of the sulcus, to see if there's a periodontal pocket. The free gingiva extends between the teeth, and that's called the interdental papilla. This interdental or gingival papilla. It's that triangular part that's in between the teeth. Interdental papilla. Okay? All right. The entire oral cavity, including the cheeks, lips, and tongue, are lined with mucous membrane called the mucosa. We went over all of that last week too. You guys pointed out the structures. Let's see, the pillars, uvula, soft, hard palate, soft palate. It's all there on that one picture. It's kind of hard to see, but it's all there. Okay, next. Next. Okay, then you went, okay, this is practical applications. You guys can do this at home on your own. I've already done it for you apparently on this slide, which is exactly what you have, because they took my notes and my book that I wrote all my notes and everything in. So, we're gonna skip the practical applications because they've got this down.
Okay, so are we on the next book then? Should be.
Yeah, let me run through these post-test questions just for grins, okay, the upper, no, I'm not gonna do that, because they know this. I know they know this. When you're studying, don't skip over it. Review it, okay? It'll be good for you. Also, when you're studying these books, I want you to make sure that you look at the glossary and know those terms, okay? Because it'll answer a lot of questions. And it helps to remind you what's going on. Okay, book 2 is Radiographic Techniques and Safety, Introduction to X-ray and Safety Precautions. Does anybody need a break?
Wait.